Hi, my name is Christine Rayfield, and this is my Week 7 practice head-to-chest assessment for NR 302. This is my patient.
Richard Rayfield, and I give Chamberlain University the rights to use this video for grading purposes.
Okay. And I am providing proper privacy, and I am washing my hands. Good afternoon, Richard. How are you doing?
Good.
Good. My name is Chrissy. I'm going to be your nurse today. What I'd like to do is do an assessment from your head to your chest, just to make sure everything's working properly and the way it should. It should take less than 20 minutes. Is now a good time for us to do that?
Yes.
Okay, thank you. First, what I'd like to do is I'm going to check your armband. Can you just verify your name and your date of birth?
It's Richard Rayfield, August 24th, 1991.
All right, thank you. And do you have any allergies that we need to be aware of, Richard? No. And for your pain, can you rate that on a scale from 0 to 10? 0 being no pain at all and 10 being the worst pain?
0.
0. Okay, good. So just starting out by your general appearance, I'm going to assess your level of conscious. So you told me your name, so that tells me you know your person. Can you tell me where we are?
In the living room.
In the living room, good. And then what is today?
This Thursday.
Thursday. And then what are we doing right now?
Your health assessment.
All right, good. So that tells me that my patient is alert and oriented ×3, knows person, time, place, and situation. I'm not seeing any signs of acute distress. Your breathing looks to be normal. You're sitting up erect. You're talking to me, so I would say that there's no sign of acute distress. And your mood and your facial expressions are appropriate for the situation. Your speech is clear. So general assessment, general survey, it looks good. Moving on to your skin, I do see that your skin is even and it is appropriate to your race all throughout. Can I see your hand, please? Your nail bed is pink. I'm not seeing any edema. No clubbing of the fingers, which is good. Capillary refill is less than 2 seconds. And skin is smooth and warm to touch. Okay, good. You can put your hands down. I'm just going to inspect and palpate your head. I'm looking for any lesions. Oh, and I would also like to use my identifiable. Okay. I did forget to say that you don't have any lesions, wounds, or incisions on your skin. Okay, back to the palpation of your head. So I don't see any infestations or lesions. And then look straight forward. Your eyebrows are symmetrical, your eyes are symmetrical, as well as the labial folds and the outside corners of your mouth. So your face is symmetrical. I'm not seeing any drooping on either side. I just want to take a look at your eyes now. Your iris is green, your sclera is white. Look up for me. Conjunctiva is pink. I'm not seeing any discharge or any redness. Your pupils are normal size, 3 to 4 millimeters. They're nice and equally round. Look straight forward for me. They are reactive to light equally. Good. And then focus on the top of my pen. It's going to come forward and out, and forward and out. Okay, good. So your pupils are consistent with Perla, meaning that they're equal in size, they're round, and then they are reactive to light and accommodation. And then I'm going to move over to your ears. Any pain when I'm palpating?
No.
No. I'm going to look at your external auditory meatus. I'm not seeing any drainage on this side. And then on that side either. And just based on our conversation, I'm not seeing any signs of hearing loss. We're communicating, you're answering correctly, you're not slurring your words. Have you had any past experience with hearing loss?
No.
No? Okay, good. So I would say that we don't have any signs of hearing loss. I'm going to look up your nose. Look up for me. And I'm looking for any signs of deformity, asymmetry, or inflammation. I don't see any. It's nice and pink up there. I also don't see any drainage. And can you breathe through your nose? And again. Any pain or discomfort?
No.
Okay, so you're getting good airflow bilaterally through your nares. I'm going to take a look inside. You can close for a second. Your lips are nice and pink. They're moist. Now you can open. And your tongue is a pink red. It's glossy and it's moist. along with your gum tissue. Smile for me. Smile. Your gums are nice and pink and they are moist, along with your buccal mucosa open. Good. Your teeth are nice and white. And I see 28 teeth, so you had your wisdom teeth removed, correct?
Mm-hmm.
Okay, so I'm gonna move down to your respiratory system, your chest. So I'm not seeing any use of your accessory muscles, so I'm not seeing any signs of respiratory distress right now. I'm just going to listen. And then I would be listening on bare skin. Look up on the upper right lobe, breathe in and out. Upper left lobe, upper right, upper left, middle right, lower left, middle right, lower left, lower right, lower right again, breathe in. Okay, good. Can you stand up for me and I can do the back? Okay, breathe in, upper left, upper right, breathe in, upper left, and I'm avoiding the scapula, upper right, upper left, upper right, lower left, lower right, lower left, lower right. Okay, wonderful. You can have a seat. So breath sounds were normal, nice and clear. Toward the sternum, the midline, I heard bronchodesiccal sounds, and then on the peripherals, I heard the vesicular sounds. So no signs of respiratory distress. I'm gonna move on to your cardiovascular system. So just visibly, I'm not seeing a visible pulsation on either of your carotid sides of your common carotid artery. I'm gonna palpate. Nice and strong, regular rate and rhythm. I'm gonna try this side. That as well. So I would say that you're 2+ bilateral on your common artery. And I'm gonna lean you back at a 45-degree angle so I can check for JVD, jugular vein distension. Lean a little bit further. So what I'm looking for is any distension between these veins on either side. I'm not seeing any distension or bulging, so that means that you're getting good circulation from your neck and your face and your head. You can sit back up for me. And now I'm gonna auscultate your palpations, your heart sounds, and again, I would do this on bare skin. And using the diaphragm first, I'm gonna go to the second intercostal space to the right of the sternum, and this is the aortic area. And then to the second intercostal space to the left of the sternum, this is the temporic area. Erb's point is the third intercostal space to the left of the sternum. And fifth intercostal space to the left of the sternum, this is the tricuspid area. And fifth intercostal space, mid-clavicular line, and this is the mitral area. Okay, good. So I'm hearing S1, S2 sounds, the lub-dub. I'm not hearing any S3 or S4 sounds. I'm just gonna switch to my bell. I'm gonna take a listen again. Aortic area. Temporic area. Erb's point. Tricuspid area. And mitral area. Okay, good. Again, I'm not sensing any murmurs, no S3, S4 sounds, no swishing. Everything sounds good. I'm I'm gonna check your radial pulse now. Can I see your wrists? All right, and those are nice and even, regular rate and rhythm. Okay, good. So before you said you were at a 0 for your pain. Is that still the case right now?
Yes.
Perfect. Is there anything I can offer for you? A pillow? Anything else to make you comfortable?
No, I'm good, thanks.
Okay, wonderful. So I would make sure that the bed is at the lowest level and that it was, the side rails were up and that the wheels were locked. You have your call light here. If you need anything, just give me a buzz and I'll come in and check on you. Otherwise, I'll come back in about 20 minutes or so just to come take a check again.
All right.
All right, thank you. And I'm washing my hands as I exit the room.